Welcome back to World Health+Social Good and Day 3 of the World Health Assembly. I'm Christy Feig, the Director of Communications for the World Health Organization, and I'll be your host today. Our agenda today is jam-packed. We will start with a major focus on keeping health workers safe in emergencies. That will focus on attacks of health facilities and health workers, especially in areas of conflict. Then we will move to an area that doesn't get as much attention as it should these days: adolescents. In the end, we will talk about an update on progress with tuberculosis here at the World Health Assembly. But I'm going to jump straight into our first panelist because she is dashing to catch a plane right now, and she was kind enough to stop and say a few words with us before she goes. There's a trend that's extremely disturbing these days. That's the increase in attacks on healthcare workers and healthcare facilities. We hear it in the news so much that often it's commonplace. It's unacceptable and it's tragic. Today we are beginning with a special guest who deals with these kinds of challenges on a daily basis. Valerie Amos, the UN's Undersecretary General for Humanitarian Affairs and Emergency Relief Coordinator. She's responsible for the oversight of all emergencies requiring UN humanitarian assistance. Valerie, thank you for joining us.
Thank you.
When you took this position several years ago, how much did you think this would be an issue? Is it something that came to your mind straight away, or has it surprised you?
Well, I think one of the things that we all sort of vaguely know is that there are protections for things like medical facilities, medical workers. I mean, actually, it's within the Geneva Conventions. And one of the things that has absolutely shocked me in the time that I have been in this job is that more and more we are seeing attacks on health facilities, attacks on health workers, not just in armed conflict situations, but more globally as well. But I deal with those armed conflict situations, and I've seen countries that are struggling to put resources into healthcare where, you know, the hospitals have been destroyed, the health clinics have been destroyed, you know, they have a limited number of healthcare professionals, they've had to flee. You've got governments that are saying that if people are involved in armed conflict, they shouldn't get health care if they've been injured. I mean, it's an absolutely appalling situation and something we need to make a lot more noise about.
Talk about what happens when health workers and health facilities come under attack. What happens to health in an area?
Well, you already probably have fragile health systems, although in a country like Syria, where about 60% of the hospitals have been damaged or destroyed, it was a very different situation. This was a country with a thriving healthcare sector that was producing 90% of its medicines. A lot of healthcare personnel have now left the country if they can. We recently got a team into the old city of Homs, and when they got to the hospital, they came out and they said to me, it's not a place to get better, it's a place to die. They said there was absolutely nothing there, and one doctor doing his absolute best to try and treat people with nothing. I went last year to Central African Republic to a hospital in a place called Kagabandoro, which was actually not being run by the authorities because there really is no state any longer in Central African Republic. I mean, this is what the conflict has led to. It's being run by an international NGO organization. 60-bed hospital. The facilities were appalling, but the worst thing that I saw were these beds that had no mattresses on them. I think 4 of the beds had these thin, worn mattresses, and I said, well, can't we at least get mattresses onto the beds? And they said, please don't do that, because they will come and loot them. And there was a woman who had just given birth. I mean, thankfully her child was okay, she was okay. There was nothing for her to eat. This year I went to South Sudan. I was in Malakal, a town which has changed hands at least 6 times in the last few months since the conflict of the 15th of December. That hospital, since I visited, patients have been killed in their beds. mean, it is appalling, and not enough international attention is on this situation.
Why is this happening? What's your gut? I mean, the fact that you see this every place you go, it's heartbreaking for starters. But why do you think this is happening?
Well,
because it is increasing.
I think it's a little bit like what happens when, for example, women and children are targeted, which is that very often you have different power dynamics, different sizes of military forces. So the weaker force may attack what is seen as a soft target, a medical facility. Or indeed, a government will attack a medical facility because they think it's in an opposition area, or it's in an area where they think people involved in opposition groups are being looked after. I mean, it is a total lack of humanity, but it's also about a lack of accountability. And this has got to be addressed.
Health becomes a political pawn, almost.
Health becomes a political pawn. It means people, it means children, women, men become political pawns. And we see it not just in armed conflict. People have seen these examples of, polio workers trying to vaccinate children who have been targeted in countries like Pakistan and Nigeria. Again, something that we would have seen as inconceivable, I think, a few years ago.
How do we renew the respect for the neutrality of health services, health workers, and the right for people to get access to health care? How do we renew that respect? What's the solution?
Well, I think we have to do several things, but I'm really pleased that the ICRC, the International Committee of the Red Cross, an emblem that we've all grown up respecting, that they have put this right at the top of their agenda for their advocacy and flagging up that healthcare is in danger. I think we can all support that campaign and really push the governments in the countries where we live to take this issue more seriously. I think we have to push the health ministries in countries where there are these conflicts to be more responsive and more responsible, to bring to the attention of their colleagues involved in the military, for example, of their responsibilities under international humanitarian law. I think we have to encourage that the data is collected, that we have the information, because data is a form of power. We can use that data as a way of making the campaign louder and more global. But crucially, we have to hold people accountable. We can't have impunity for something like this.
Valerie Amos, thank you so much for coming by. I know you need to run to catch an airplane, but just the fact that you came to the World Health Assembly to bring attention to this issue speaks to the priority that this is getting today in public health. I thank you for everything you do.
Thank you.
And I thank you for coming by to speak with us. Valerie Amos was the panelist, co-chair of the technical briefing today, talking about healthcare under attack. It really speaks to the distressing trend that we see of the increase in attacks on health workers, on healthcare facilities. She just gave us some great examples of what she sees on a regular trip when she is going to some of these countries. We're going to talk shortly with ICRC. She mentioned the ICRC campaign, Healthcare Under Attack, and we're going to be talking to them just a moment to go a little bit deeper into this topic because it is such a concerning trend in public health right now. But first we have Sari Setiogi, who has come by for her daily visit, and we're going to touch base and see what's going on in our social media platforms before we go back to the topic at hand. Sari, you covered the technical briefing at lunch on healthcare under attack. Is there a lot of social media interest and discussion on that topic?
Absolutely, Christy. Thanks for having me here today. The technical briefing room was packed. A lot of people tweeted that there are a lot of good sound bites, very touching, very good reminders. For example, from Dr. Chan, one of the most retweeted tweet from the technical briefing was that healthcare workers needs to be protected at all time. And also Valerie Amos said that health should take priority over political maneuvering. That's a very good reminder that also got retweeted quite a lot. And ICRC President Peter Maurer, he also said that when the health system collapse, infectious diseases re-emerge, that also got picked up quite a lot. And then the sound bites from the countries, that's also very, very interesting, from Central African Republic, from the Philippines, from Colombia, that also got picked up a lot. And for me personally, it was really shocking to hear that even the hospital mattresses got looted during the crisis. That was really shocking.
That's right. This is such a disturbing issue for people who work in public health on a regular basis, so it's getting a lot of attention today, but there's other topics going on here at the World Health Assembly today. What else are you hearing on social media? What are we talking about?
Yeah, it seems like this year there are a lot of side events happening at the same time. Today, lunchtime was really, really busy. The technical briefing was popular, but we also noticed on social media there are side events that are also similarly popular. For example, one that talk about palliative care, that also got a lot of tweets around that. And then the other one is on access for medicine in middle-income countries. That also circulate quite well on Twitter. I mentioned earlier there are a lot of interesting technical briefings, and our Director General, Dr. Chan, has been trying to attend almost all of them as much as she could, and I think people noticed that, and considering that the distance often from one room to another is quite far. I saw someone who tweeted saying that, yeah, probably it would be nice for Dr. Chan to be on roller skates so she can move faster from one room to another. That's very thoughtful, but we like to walk. It's good for health.
We're not sure we want her on roller skates, but I think it would probably help her, yes. It's true, there really is some a spread of
quite
ground
a distance,
to cover between these. Now, your backstories, I think this has been our viewers' favorite part of the social media platforms. What is your backstory today? Who are you talking to behind the scenes that make this event happen?
Yeah, a lot of interesting stories, a lot of interesting people, people that often probably we don't see on day-to-day during the assembly itself, but the assembly probably wouldn't be able to run so smoothly without them. The first person that I spoke to, it was based on the request from our follower on Instagram, is our cleaner, Rosalia. She's been cleaning at the Palais for 21 years.
Wow.
And during the assembly, she starts at 5 o'clock in the morning.
5 in the morning.
What a dedication.
Wow.
So our thank you for her.
Wow.
The second person is the interpreter. She's interpreting from English to Chinese and also to French and the other way around.
Wow.
She's been interpreting for World Health Assembly for WHO since 1993. So she knows quite a lot of public health terms, that's for sure.
She probably needs a public health degree.
I think so.
That's one of the most impressive jobs. The interpreters have an amazing
a lot of responsibility,
here, yes.
That's for sure. And this is our chef. These are Philippe and Nicolas, and they're the one who prepare the meal at the cafeteria. And they were telling us that during the assembly, the number of plates that they prepare doubled, and for sandwiches it tripled. So we're dealing with hungry
compared to
delegates compared to normal times. That's correct.
Okay, I'm not sure we want to know about the caloric intake of the health officials
I didn't ask
during
that.
the assembly. Excellent. Who are you going to be talking to tomorrow?
We got several lining up.
Do people get to put in their suggestions?
Yes, and we're also welcoming for any suggestions. That's correct.
All right. Sorry, before I let you go, remind everybody how they can follow us. You'll be tweeting the resolutions and decisions as they're taken?
That's correct.
How can they follow us?
Yeah, on Twitter they can follow us at WHO and hashtag WHA67. And on Facebook it's facebook.com/WHO, and on Instagram we're at World Health Organizations.
Thank you so much for joining us, and we'll see you tomorrow. Now, I want to move back to the discussion that we started with Valerie Amos just a moment ago, healthcare under attack. You've probably heard of the Geneva Convention's international humanitarian law, maybe. This is international law that says in armed conflict, health workers and health facilities must be protected. Wounded and sick are also protected, as well as those caring for them. As I mentioned a moment ago, this was the topic of our technical briefing today. Joining me, we have two people who were also involved in that technical briefing. We have Dr. Rudy Konix from WHO's emergency team, and we have Pierre Gentile from the International Committee of the Red Cross. I'll start, and you're wearing your t-shirt. I'm so impressed, Rudy. Excellent, excellent. Make sure everybody can see that. What is your t-shirt there? Show everybody.
Well, here we go. This is.
We're informal here.
We are informal, yes, exactly, and it goes with the poster and with the promotional material that we have made. And we are delighted that we have this opportunity here, where we have all the ministers of health together to come and discuss about attacks on healthcare workers. And we have to do something about it. That's what it was all about.
It really is such a huge issue. I want to start with backing you up just a step here. How alarming is the trend of increasing attacks to you? It is increasing, right?
Well, we think it is increasing indeed, and we hear more and more about attacks of healthcare workers, about health facilities being destroyed, and about patients being killed in the hospital bed. We haven't seen that in a while. It's not that it never has happened, but it seems that we hear more and more about it.
You know, one thing about being in the heart of the Palais here is whenever we see people coming by that we want to grab, we have the right to grab them. It's why we put this booth here. So we're going to add a third chair if you'll bear with us for just a second. We have Dr. Rick Brennan as well. I told you this was an important topic. I told you it's a major focus here today, so we want to add Rick to the table as well. Rick is our Director for Emergency Response at the World Health Organization. Thank you for fitting us in. I know you just ran from Committee B.
I did.
And I'm grateful that you did, so thank you. Let me start with you. If you need to run back, you can slip out after we have asked you the questions we want to ask you, okay?
Sure.
Rick, talk for just a second about this problem. Give us the big picture. Why are we putting such a focus on healthcare under attack?
Well, I think the issue of the increasing scale of the problem is our primary concern, but not the only one. We're seeing more and more health workers, patients, health facilities, ambulances coming under attack in a broad range of settings now, particularly in conflict, but not just conflict settings. So the increasing number, but also what it says about our values in these various settings. When you think that the sick, the injured, those most vulnerable and their carers are under attack, you know, what can we respect and protect in our societies if it comes to that? So we're worried about the implications of all this as well, the implications for access to healthcare, the implications for what we consider as every human being's right to health, and then associated with that, again, that sense of the sanctity of healthcare. If we can't ensure that, what can we ensure as cohesive, humane societies? And of course, there's the other dimension that the ICRC remind itself constantly of the special status of healthcare providers and patients under international humanitarian law and the violations there. So
you've been working in disasters and emergencies for well over a decade. I don't mention that as in you're old. I'm mentioning that as in experience and time in these environments. This is really a much different environment for this today than it was even 15 years ago, 10 years ago.
Well, I mean, it's certainly been there in every conflict that I've been associated with. I think what's concerning is the scale and the character of it now. I mean, in certain conflicts recently, we've seen systematic targeting of health facilities. We've seen inhumanity. I was in South Sudan just a few weeks ago and speaking to our country representative there, and he walked into a hospital where elderly women who were patients in beds were bludgeoned to death. And he just couldn't, he was struggling to come to grips with the inhumanity of that. So we've crossed a line there, obviously, that makes us all want to sit back and reflect, what does it mean to really affirm the humanitarian principles? And what do we need to do collectively to better embed those principles in our societies, even in the most difficult times, even during conflict, I think. So yes, I mean, things do seem to have changed.
It's the last thing I actually want you to reflect on, and that is the solution. How do we get that respect back for healthcare in conflict situations?
Well, I think that we had a wonderful panel earlier this morning, and we had some experts, some real experts, and people who've lived it and experienced this issue, and I think we got some very, very good guidance from them. I think it requires a number of different steps and measures. We need information. And WHO, we are working on a methodology to more consistently collect that type of information. Our colleagues at ICRC have done a great job in also presenting the scale and nature of the problem in some of their reports. So we need data. We need to be able to describe what the problem is. Secondly, I think we need, as we're hearing today, we need political leadership on this issue. We need the leaders of our countries and those, particularly those undergoing conflict, to recognise this as a problem, to ensure that those basic principles, embedded in international humanitarian law, in human rights law, are promoted and they're respected and they're applied by their security forces. But we need that on both sides of any conflict. I think that we need constant advocacy at all levels of society on this. And we need, there are many different fora in which we can promote these principles and these values. And then I think we need we need a legal framework. We heard that, how effective that was in Colombia. I think we need some concrete measures. I mean, again, our colleagues at ICRC are exploring different preventive measures. We're working on similar measures, particularly through our Safe Hospitals initiative. So I think there's a range of issues that need to be addressed, from the advocacy to the real concrete field-based interventions.
Terrific. Dr. Rick Brennan, thanks for coming by. Thank you for letting us snag you as you were walking down the hallway.
Thanks.
There. You can go back to Committee B if you need to, but you have to leave the microphone behind.
I shall.
And I'll have it passed to Pierre if that's okay. Pierre, he was just talking about advocacy. The ICRC really was born out of the Geneva Conventions. Your Healthcare in Danger campaign really gets right back to the heart of it, doesn't it? Tell me a little bit about the campaign, the project.
The project is actually based on the idea that indeed the issue is unfortunately global, affecting many countries where armed violence is present, and that disrespect for healthcare worker, infrastructure, or transport is widespread. But it's also based on the constatation that there is a lot of measures that have been taken by different stakeholders in those countries to try to improve security for healthcare delivery, and that we try to bring the different experts around the table to capitalize on those experiences, on these good practices, to identify the measures, concrete measures, recommendations, to then be widely disseminated. So the idea is that there is no magic bullet. Unfortunately, there is no one single recommendation that would change really the landscape and provide safety for healthcare, but there is a wide range of measures that can be taken, being by the militaries, being by religious leaders, but also by healthcare providers themselves. And it's all of those measures that we try to capture through the project.
Don't mind these. When these pieces of paper arrive on my table, these are questions that our viewers are sending in. So we've got a team over here that's writing them down, and they slide them up here. So when you see me turn and look at these, that's what this is. This one is for you. And the question is, who is supposed to protect those facilities?
So healthcare facilities, we just had 2 series of workshops precisely on the issue of protection and security for healthcare facilities. And what came out very clearly out of it was, in the first place, that you have a lot of things that can be done preventively to try to make sure that you have anticipated the risk, that you are able to make sure that the facility will continue functioning. So in terms of the basic supplies, water, medicine, but also electricity, fuel, you have the capacity to maintain the functioning, even if those will be disrupted because of the violence of the conflict. The second aspect is that you also have to pre-plan it with scenarios with your staff. There is a changing aspect in the work to be done, to be carried out, and this can be also trained. It's also quite clear that the manager of the infrastructure has a responsibility to make sure that precisely he is able to support his staff, is able to take these measures internally, so internal organization. There is also a role, of course, of the authorities to secure the area, to make sure that there is no military objectives or activities in the near surrounding of facilities, so as to distinguish really where people can come for support when they need precisely to reach a facility versus places that can be deemed as strategic for military purposes. There is also a responsibility, of course, of armed actors in general to respect those infrastructure, not to come in, not to loot them. There are measures that can be taken to prevent, to some extent, of course, the looting, better control of the entry, better control of the flow of people that will come in during an emergency, better control of the surrounding, etc. So a lot of different measures, preventive, during the event, that can try to improve the security of the facilities.
You just touched on something there I want to spend one more moment on, and that is the idea that the Geneva Conventions and international humanitarian law is not about ending war. It's about giving rules in war on what should be considered safe and neutral and other areas. What does the ICRC do to help educate armed actors in a conflict about that? Because increasingly it's not necessarily an organized armed group. What does ICRC do about that?
In every situation of conflict, what we try to do is always to have access to all the parties and make sure that with all of the parties we have a way to discuss both in a preventive manner the risk that we see, but also in a reactive manner when we see that there are indeed incidents, to discuss those incidents with the parties. It is, of course, depending the context, more or less difficult to have access to everyone, but it's always something we will try to achieve. So this willingness to really be able to have a dialogue on the reality on the ground and have a dialogue on the measure that can be taken to improve, in that case, security for infrastructure, healthcare personnel. It's something we'll always be trying to look after and trying to establish the contact from the ground level up to the chain of commands.
Okay. Rudy, let me ask you a question before I let you go. Talk about WHO's part of this. How is WHO working in countries in order to help make healthcare and health workers safer in times of conflict?
Well, WHO, its big strength is that it's present in most countries, so we can talk directly to all parties, to the ministries of health, to the people who are interested in this file. And important role for WHO is to lend its voice to the issue of it is not okay anymore to attack healthcare workers. It is not okay in 2014 that hospitals are being attacked and that healthcare is denied to people when they need it most, quite often in conflicts, but not only in conflicts. So WHO is doing this now to make sure that everybody is aware that there is a problem. There's a number of solutions, and Pierre has listed quite a number of solutions that can be applied. And it's time for us now, together, to apply these solutions and stop this attacking of healthcare workers and health facilities now.
It's time for real people to be outraged about this again.
I think so. It is outrageous that today it's still happening, and nobody seems to be disputing the fact that, yes, indeed, Rick Brennan has mentioned have we lost our moral compass? Nobody seems to be disputing that, but it's time now to put this into practice, and that's why it's important that at this event, where everybody, all ministers of health are here, that at least we bring this to the fore and lend our voice to this campaign.
You almost got off this panel, guys, but there's one more question that's come in, and this is a follow-up for Pierre. Can you clarify, does international humanitarian law discuss role of government? And I'll give you 30 seconds or less to answer that.
Indeed, it does. Government, national security have the obligation to integrate international humanitarian law into their national legislation and then into their practice. And to give you one example of a recommendation that goes into that direction, one of the issue that was noted in many cases is the difficulty at checkpoints for ambulances sometimes or private car transporting wounded and sick to pass. And of course there is a need that we understand in terms of security to check the cars. But that's where you have the training, the procedures coming in. Government have the necessary obligation to make sure that when they set up checkpoints which are legitimate, they also make sure that in the training of the troops there is the understanding that ambulances have to be prioritized. that you have to combine the security measures with an obligation to make sure that people have access, timely access to the necessary healthcare. And this goes through training, goes through procedure that have to be integrated. Those are preventive measures, but if this is not done on the D-Day, of course you will face more problems.
Okay. Thank you both very much, Dr. Rudy Connex from WHO, Pierre Gentile from the ICRC. Thank you for all you do on this important topic, and thank you for coming by today. We appreciate it. We're going to change topics now here at World Health Plus Social Good, but I encourage you to stay with these campaigns, stay with this topic, keep up with it through the ICRC and through WHO on our social media platforms, because it's incredibly important. And as you heard them say, it's going to take help from everybody in order to create the outrage about attacks on health workers and health facilities again. Now, we're going to switch gears here, and we're going to talk about a topic that doesn't get a lot of attention. We spend a lot of time talking about the health of young children. We spend a lot of time talking about the health of adults. What we don't spend a lot of time talking about is adolescents. And I'm talking about young people between the age of 10 and 19. Last week, WHO put out a report focusing on them, and we're going to give that some attention now. You're going to need this. Joining me to discuss the health needs around adolescents is Jane Ferguson from the Department of Maternal, Newborn and Child and Adolescent Health at WHO, and Lois Maturo, a volunteer counselor in Zimbabwe. Thank you both for coming by to talk about this. Jane, sum it up for me to begin with. What did the Health of the World Adolescents report find?
So first of all, thank you very much, Christy, for giving us an opportunity to talk about adolescence. It's our favorite subject. So, and we're really, really tickled pink about the report. The report findings, per se, the things that hit the news are really the things that are the causes of death and the causes of illness. And from that perspective, the news was not big news, because what we tried to look at mortality and illness from 2000 to 2012, and there we didn't see a lot of change. There's a couple things that were remarkable. One is the big increase in HIV death among adolescents, which is very concerning. And the good news is a decrease in deaths due to maternal causes. So that's kind of the big news in terms of change. Otherwise, the major cause of death of adolescents is road traffic accidents, and we don't often think of it that way, and it's not necessarily adolescents driving. These are adolescents who are walking to school, playing on the street. That's where the cause of death is. And then the other thing that is of great concern, which hasn't changed, it's still the same, in terms of illness, adolescents are unhappy, they're depressed. So that's the major cause of illness in terms of the findings.
It was the first of its kind, really, for a report for WHO on this. But it was more than the topic that was unique. What else about the report was unique?
Its format.
Yeah.
It's completely online. It's web-based, and it's not going to be printed. We have a short summary, but it's not going to be printed. Although you can print the pages, it's completely searchable. And it includes, it's more than a report actually, it's a resource. So it has interactive materials in it that people can use for presentations that explain things. It has all the data that's in it. You can ask for a particular country or a particular illness or a particular behavior. And so it's very, very interactive. And the other thing about it that was actually the motivation why we did it as web-based was I found, working in adolescent health, that the organization does a huge amount for adolescents, and not just in my department, across the organization. So what could I do to try to find, be able to identify for people in the field what materials and guidance and recommendations WHO makes. So the best way of doing that was doing it online. So you're able to zoom right in, hyperlink right into the page where you see a recommendation, which is a huge resource for me, because I always looking around for it. So that's, I think, what's unique about it.
Super. Talk about why it's so important for us to understand the health issues of adolescents. If we understand the health issues of adolescents, how does that benefit us down the road?
So first of all, I mean, the distinction we keep trying to make is that adolescents are different from children. Of course, it depends on their child health and they move into adolescence. and they're not quite adults. And so it's a wonderful period of time for many, many adolescents, and it's the time where evolution and social change happens is during this period. It's also the time where adolescents are taking on attitudes and behaviors that stay with them for the rest of their lives. So for me, the best example is non-communicable diseases. You know, the 4 risk factors for non-communicable diseases are all conditions or behaviors that are adopted or reinforced during adolescence: tobacco use, alcohol use, inadequate physical activity, and inadequate diet. This is what goes on and during adolescence, which are the big 4 risk factors for non-communicable diseases. So that's probably the best example, although it fits for the other health areas as well.
I'm wondering if that's actually the answer to my next question, which is, what are the top actions that adolescents need to do, or that people need to do in order to focus on the health of adolescents?
So I think that what we would say, the reason for this report was really to say that the health sector needs to be paying more attention to adolescents. When people think about the health of adolescents, they think often of education, which is important, critical, and they think of parents, also very important, but the health sector has a role. And one of the key things is really data and better collection of data about this age period, because although we've got data and we've got it in the report, it's all estimates.
Okay.
And then there's better analysis of data. I think the other thing too would be to be improving the evidence. So we've got a very good video, we've got several good videos in the report, but one that's been done by CDC talking about the evidence base in preventing violence. And interpersonal violence is a major health issue as well for adolescents. So, and they present a beautiful story about what the evidence base is. But we do have problems in terms of actually learning more about how to implement some of the recommendations and some of the things which we know work. So that would be the other thing. And then I think that in terms of the health sector thinking of not only service delivery, adolescents absolutely need better access to health services and other things, but the policies that are in place, that policies which limit marketing, for example, of high sugar, high salt food, are critical for adolescents in terms of their diet. So it's a mix of both policies and services that the health sector needs to take on board.
Jane, you touched on something just a minute ago that piqued my interest there, and I'd like to talk about it a little bit with Lois. The report found that the number of HIV-related deaths is on the rise in adolescents. At a time it's dropping in many other groups. It's now the second leading cause of death for teenagers. Lois, you work as a volunteer counselor for adolescents with HIV. Tell me a little bit about your work.
Okay, basically I offer counseling on adherence to my other peers living with HIV, and I also do home visits to them, monitoring them if they're doing well, and also following up on defaulters who are defaulting on antiretroviral therapy, and also linking them with the community clinic so that they get monitoring, so that they get better.
Talk about some of the real-life challenges these young folks face.
Okay. Most of the biggest challenges that we face as adolescents living with HIV is stigma and discrimination, and this is the most biggest cause to adolescents' death. And most of the time adolescents tend not to take their medication because of the stigma that's going around within the communities and sometimes in the families that they are living in. And the issues to do with faith healing, it's most often where adolescents, they are told that they are being healed from HIV whilst they haven't, and later on fall sick. And sometimes we get confusing messages from the health workers, like the doctors and the nurses, and in a way that we are not able to understand. So we also need to be able, healthcare, to be trained on how to offer services to adolescents in a way that we understand and we feel comfortable.
It must be very powerful and helpful for the young people to have you guiding them along this road. What do you advise them? How do you encourage them?
Basically, sharing of personal experiences has been a very real good thing, because they get to look at me, and also sharing my personal experiences when I got to get tested and how I look now. It actually gets to motivate them to continue with their lives and have dreams and hopes as well in their lives.
This is a question that's coming in from our online viewers. Whenever you see a card that comes in on the table, don't be distracted by it. It's just our online viewers sending in questions, which we encourage them to do. The question is, and I'll let either of you take it, how can governments prioritize adolescent health, specifically Aboriginal teens?
Okay. So Aboriginal young people, or young people who are, kind of part of a minority group, either because of their ethnicity or because of some of the behaviors that they engage in, are a concern across the board. I mean, we often kind of say that one of the problems with adolescents is that they're healthy, and most of them are.
Okay.
But many of these teens are, in fact, the determinants. They're less likely to have good schooling. They're less likely to have resources at their fingertips to be able to confront the normal things that are going on in adolescence. And maybe Lois could talk about that in terms of kind of the normal things that all adolescents want. And when you're ill, or you're confronted with some of the major kinds of social problems that Aboriginal teens are, it becomes difficult to kind of overcome that.
You want to add anything to that, Lois?
Yeah, I think health workers need to be really trained on how to give the message to the adolescents, and also to be disclosed earlier, because most of the adolescents, they are not being disclosed about their HIV status earlier, which making the adolescents not to adhere to their medication, thinking that the ARVs, they are not important. So I would rather say training health workers should be prioritized.
What do you see on a regular basis as the most pressing health needs of young people?
Okay, I think most of the health needs of adolescents is being given the information, rightful information that we're able to understand, and also having support systems like the support groups, and also peer-led activities, like for example, the CADS program that I'm also involved in. It's called Community Adolescent Treatment Supporters. It's a group of young people who are trained to give services on treatment care and support to their other peers, which is really a helpful tool. It actually got impact to other adolescents to keep them healthy and confident about themselves. Yeah.
Super, Jane, I'm going to follow up on that with you. What is something that WHO is doing to help countries be able to improve the health of adolescents?
So, well, there's many things that WHO is doing, and that's, again, there's snippets of that across the report, and so it's been a real privilege. We've had great partnership around all 12 departments in the organization dealing with specific issues and talking specific kinds of recommendations and actions. So the kinds of things that our department has been working on, where we've been really seeing some improvement, has to do with improving health service delivery for adolescents. And, that has to do with, again, Lois was saying it, training health workers, is one of the key things. Also helping adolescents understand what they need in terms of kind of using health services, because sometimes they don't know, they don't have that experience themselves. So we have a set of we help countries to develop standards for health service delivery to help them improve health services, and it's been going. We've been involved in about 30 countries, low and middle income countries around the world, and we'll have a side event where some of the countries are going to be talking about where we can actually measure improvements in health service delivery through increased numbers of adolescents coming for needed health services. So that's across the board, whether it's for HIV, whether it's sexual and reproductive health, mental health, which is also a major issue too.
Super. Thank you for all the work you've done to bring this to our attention more. You have a big side event here at the World Health Assembly. When is that?
That's Friday afternoon, Friday lunchtime at 12:30. And we have speakers. Lois is going to be speaking. We have another young man from Colombia who's actually part of the report. We have the Minister of Health from Moldova, one from Zanzibar and Tanzania. We have high-ranking officials from India, where they just launched a very exciting adolescent health strategy, and from Norway.
Super.
So it's going to be a packed
Packed room.
program.
Have a great time at your side event. Thank you for coming by. It was great to visit with both of you.
Thank you very much.
Now, there is already news happening here at the World Health Assembly. This morning, the member states adopted a resolution endorsing a new global strategy for fighting tuberculosis. It contains targets for TB prevention, care, and control after 2015. Joining me now to talk about this achievement and work in tuberculosis is Dr. Mario Reviglione, the Director of the Global TB Program at WHO, and Dr. Christoph Ben, Director of External Relations at the Global Fund. Mario, before we talk about the news of the week, take a step back for our viewers. Give me the global picture of tuberculosis, the global epidemic. What is it? How is it?
Yeah, it's big problem. Remains one of the major killers in the world. We are talking about 1.3 million people dying, meaning 3,500 people dying every day. We are talking about nearly 9 million cases every year of a disease that, after all, is preventable and curable. And with some problems, additional problems in Africa, particularly where you have the association of AIDS and tuberculosis, or in countries such as the former Soviet Union countries or other parts of the world like China, Peru, etc., where there is or India, where there is quite a high number of multi-drug resistant TB cases, meaning cases of tuberculosis that do not normally respond to the conventional treatment and for which we need more drugs, much longer treatment with effectively costly and toxic drugs at the time.
Okay.
Big challenge.
People are used to hearing about the Millennium Development Goals. Talk about how we are doing with reaching targets for tuberculosis with the Millennium Development Goals for 2015.
Yeah, the target set in the context of the Millennium Development Goal was considered not that ambitious. You know, what happened there is that during the 1990s, you had an increase in the incidence, in the number of cases that were emerging every year. And so the goal was simply to make this epidemic go down. So stop the increase and start seeing the decline. And that was reached, in fact, in the case of tuberculosis in the early 2001, 2002, in our best estimate. And at the moment, the incidence is going down at 2% per year, which is good, but is far from what people would like to see. We would like to reach at least, with the current tools that we have available, some 10% per year, which is what Europe did, or North America did half a century ago.
All right, now we have a new strategy and targets for reaching for 2035 eventually, yes. Talk about what's in there. Talk about what the aim is and what the targets are.
We decided as Secretariat of WHO to promote with our member states, and fortunately they all accepted and in fact endorsed these targets, something very ambitious this time. So we really want to go to a situation where we will have, as we say, zero deaths, zero suffering, zero disease. So we don't want to see tuberculosis anymore. And we know that this is possible as long as certain conditions apply, to this type of situation. Number one is that we must increase rapidly the uptake of everything that is innovation in tuberculosis, both new drugs, new diagnostics, or innovation in the health system response, including, for instance, social protection for patients, including universal coverage, which means really minimizing the cost to the patients. These are the poorest among the poor. By applying all of this, like it happened in Europe post-war, we may probably achieve something major in the next 10 years. However, we need to invest now for new tools, research of new tools, because after 2025, we will need to accelerate further if we want to reach these ambitious targets.
When you say we may achieve something major, how major?
In 2035, we want to go to 95% decline reduction in deaths compared to 2015, 95%, and we want to go to 90% reduction in the number of cases that appear every year. Plus, we want to have zero catastrophic costs, as we call them, for patients with TB. So we don't want the poorest to pay more than they can afford, which is basically very little, to be cured from tuberculosis. We want the governments, we want the states, we want everyone involved in such a way that this doesn't happen.
So what is it going to take for governments to do in order to achieve this?
It takes, I believe, two things. One is commitment to do it, adoption of these new targets, of this new strategy, and it takes financing. So you need resources to be able to really do that job. And it needs, of course, investment in research as part of the financing, because that we count very much on the issue of new tools.
Okay. It sounds very challenging, and it's certainly going to take the help of partners, I imagine, in working towards this. Let me turn to you, Christoph, at this point. Why are these targets, these new targets, this new work, so important for Global Fund?
I mean, this new strategy is extremely important for the Global Fund, and really congratulations to Mario and the whole team at WHO to get that approved this week. This is a fantastic achievement. And for the Global Fund to fight AIDS, tuberculosis and malaria, I mean, tuberculosis is one of the major diseases for which we are mobilizing resources. And setting these targets is extremely important. That's the only way also how you can mobilize political support, how you can mobilize financial support. These are very ambitious targets, as we've just heard. It would be fantastic if we could reach, you know, those targets, 95% reduction of TB mortality over the next 20 years. And the Global Fund can now mobilize around that. We want to see that in the post-MDG framework. That would be very important to get the kind of political support for that. And then we can introduce that into the kind of proposals that we are receiving from the countries as tuberculosis programs that we as the Global Fund can finance.
You know, Christoph, a lot of our viewers don't necessarily know how we work together, and we select these panels by some of our with some of our best partners. Talk for just a second about that partner aspect of it. How does Global Fund work with WHO to help the countries get where they need to be?
The Global Fund really is a partnership. We are not just working in partnership, we are a partnership. The Global Fund couldn't exist, couldn't achieve any kind of goals without the partners. Because we are a financing institution, we have no country presence, we are not providing any technical support. So we need partners like WHO, like the Stop TB Partnership. We've just signed actually a new memorandum of understanding with WHO just yesterday. It was one of our kind of big events here at WHA, and that will ensure that we work very closely with WHO to provide the technical support at the country level. Because we have just launched a new funding model. That means, we are providing new resources for the fight against AIDS, TB, and malaria. But that needs to be translated into effective programs and, first of all, proposals at the country level. And that requires a strong partnership with WHO, with other UN partners. Otherwise, it won't work.
Terrific. Thank you both for coming by. I really wish you the best with this exciting new strategy, and it sounds like it's going to make a huge difference in the TB epidemic around the world. Thank you both very much. That's all we have time for today. It is a packed agenda, as I told you, but I think it was well worth the fast pace that we had to carry it through today because some very hot topics in public health. Tomorrow, we also have a big day. Another trend that we're seeing in public health across many of our member states and countries is the increase in hepatitis and the realization that it is a big problem in many places, and we're needing to find some ways to address it, to get treatment where we need to get treatment, to turn off the tap of new infections, and that's something that's going to take a lot of hard work because many of these risk factors for this, the way that people are getting it is often from places that they go for health care. It could be from a blood supply that may not be safe. It could be from infection control practices. So it really is a public health problem that we all have to work together to address. We'll be talking about that tomorrow. We'll also be talking about the post-2015 goals. This is something that we talked about in one of our panels here. We're very familiar with the Millennium Development Goals, but that's reaching for 2015. What happens after that? That's the discussion that is going on right now. Where does health fall into the post-2015 agenda? We'll also be talking about childhood obesity. You remember from the Director General's speech on the opening day, she announced a commission to end childhood obesity. This is something that we will have an in-depth discussion on tomorrow. Why is childhood obesity a problem? And what are the public health officials around the world going to do to try to get that contained? Finally, we'll be talking about vector-borne diseases. That's a very technical term. Vector-borne diseases is simply insects, bugs that carry disease. Malaria falls in there, dengue falls in there, chikungunya falls in there. These are diseases that are very difficult to fight, but they also make people incredibly ill. It was our theme for World Health Day this year in April, and we'll be getting a visit from one of our experts on that to talk about how we're trying to get that contained in health today. All we have time for today. We'll dive in deep on those topics tomorrow. Again, thank you for joining us.